Hello and welcome. My name is Dr. Lianov, and I'm the president and founder of the Global Positive Health Institute. And welcome to our GPHI podcast series, where we talk about all things related to positive psychology, positive health, and lifestyle medicine and how they relate to each other. And so today I am delighted to have with us as our guest, hopefully I can pronounce it right, Samandika Saparamadu.
That's right. Thank you.
And
Thank you for having me.
He is a physician with lifestyle medicine board certification and has a master's of public health as a candidate through Johns Hopkins Bloomberg School of Public Health and a Health Policy Institute fellow at the Maryland General Assembly, a mouthful. So welcome, Samandika.
Thank you. Thank you very much. And thanks for having me. How are you doing today?
Wonderful. And I'm always happy to have the opportunity to talk about this favorite topic of mine. And
right.
And you've been also, I should say, an active member with our GPHI Advisory Council. So thank you for that. So you've really shown a passion for both lifestyle medicine. So let's jump in, and please share with us what really grabbed your attention about these topics and how important they are.
Oh, right. Yeah, that's a pretty good start to a place to start with. I think besides basic trainings in behavioral sciences and psychology and psychiatry, which are very different subject areas. In the medical school, I think the first introduction was through some of the TED Talks by Prof. Martin Seligman. That was I think, first introduction. And then ever since, been reading around them. And then after that, the proper exposure was through the lifestyle medicine board review course. Yeah, and that's where I started learning. Okay, there are other things that we never knew about health and well-being, and that there are the matrices and other variables that we can think of, especially when you want to practice and incorporate things into your practice. There are different ways of going about that. So I think that was the beginning.
Yes, it's interesting because as you know, I've been involved in the early days of lifestyle medicine, and we certainly have in lifestyle medicine really focus on the core pillars that we call of lifestyle medicine with healthy habits. But ultimately, these additional factors, what I'm calling health protective factors that you're mentioning for well-being in positive psychology and positive health, are really essential to help us be successful in lifestyle medicine. So how are you using it now, professionally and personally?
Oh, well, personally, not to a great deal. In a very unhealthy lifestyle right now. Very unhealthy lifestyle for the last few months to a year. I think it's been extremely busy, so not that great, to be honest. And not practicing at the moment right now, but I used to practice in Singapore. So back in my practice, we used to use it mainly for a very specific cohort of patients, particularly those people with either stress problems, some form of stress, diagnosis of stress-related diseases or disorder, or particularly people with mild to moderate depression. So that was very helpful. Particularly, I think things around PERMA as well as micro moments of happiness. I think those were the two things that I used to use more often, like more in long consultations. That was quite helpful. That's if it is, of course, moderate depression, often accompanied with other treatment modalities. But that positive psychology played an important role, I felt. The reason being very busy settings, highly mechanical settings like in the US or in Singapore, that can be very useful for people to start thinking about what's happening around them. Like, how to think about things positively, about how to reflect on life positively, or how to take things in a positive way, or how to rethink about their relationships, right? And take a fresh look at their accomplishments, etc. Those are very important. And more importantly, I felt the use of micro moments of happiness was quite remarkable, because for instance, like in an extremely busy area in Singapore, if I open a door or hold the door for someone, people will not even notice that, and not consciously. They're not being they're consciously being rude. It's just that it's extremely busy. Like it can happen to me as well if I'm in the same situation. They might later notice it, but it's already too late. The moment has passed. So being aware about what's happening around you and paying attention to do those simple things and saying thank you or appreciating something wholeheartedly, that those things can actually add a lot of things to your well-being, as well as the kind of feeling that you get at the end of the day, the feeling of accomplishment, and the feeling of being rather just being fulfilled and feeling happy at the end of the day. Yeah.
Yeah, I think
Yeah.
you're referring to that, those positivity resonance, the micro moments of positivity resonance, when for even
Precisely.
for 30 seconds or less, if we have an authentic connection with someone else, it can boost both for both individuals their physiology in positive ways. It boosts their parasympathetic nervous system, which is good for us. It lowers our blood sugars, our blood pressures, and cortisol, all the things that we're looking for to help
that's right.
prevent and treat disease. So it's a wonderful example, because that is something that we can, even like say in very busy settings, we can put attention to it, and it won't take too much time. But throughout the day, if we have these kinds of encounters, many of these throughout the day, that can add up to feeling more happy and satisfied, as well as more physically healthy over time.
Yeah, that's quite right. And to be very frank with you, I think in the practice, because of the model that we use, particularly in Asia, I think even in the US, it's pretty much the same, often driven by numbers. So in that situation, the patient time with each patient is fairly limited. And particularly in primary care settings, it can be even worse. So I think it was not possible for me to use it in every patient, but yeah, as I mentioned earlier, for a small cohort of people, particularly people with depression as well as stress disorders, that was very helpful. Yeah.
Well, you bring up a good point, because this whole area of positive psychology and positive health is very important in helping people change their behaviors towards physical well-being. It's also very important for those who are struggling with depression and other mental health conditions. And in medicine, we have some space to take the time, a little bit of time, to address those important conditions, such as stress and depression. But what would be wonderful, and that's what at GPHI we're working on, is to expand that to all patients, because even if they
Absolutely.
don't have the depression or the stress, we can really benefit from these additional health protective factors over and above the usual healthy lifestyles. But it's difficult, right?
Yeah, that's true.
For busy
I
people.
totally agree.
Yes.
Yeah, I mean that's the ideal way, and that's in an ideal situation, ideal world, that's the way it should be. I think eventually people will get there at some point in time, but still, it's a learning. I think it's a work in progress. I think. Yeah.
Yes. So,
Yeah.
what do you have any recommendations you can share with the listeners, our health professionals in the audience, about how they can incorporate this in a more useful way?
I think starting from something very small and specific is the easiest thing to do, because if you start applying this to everyone in every situation, then it can get monotonous for you in the first place, because you might start feeling, oh, I'm just repeating myself over and over again, or at the same time, patients also might see certain patterns and might not like what they're experiencing, especially if they are frequent visitors. Yeah, so maybe having a defined population of patients, and then having a specific identified tools, and of course we have to be very careful, especially if you are dealing with patients with depression, like what degree of depression that you can afford to introduce these things. Are they going to be useful? Because there's not a lot of evidence if you are having, anything more than moderate depression. Probably this is not going to be very helpful as the first line therapy, or even as supplementary therapy when they are having all their neurotransmitters going haywire. Just asking them to practice micro moments of happiness is not going to be helpful. So understanding that those important things, at the same time identifying a specific patient population, starting at a very small level, I think is that what I would think of doing. I don't know. Do you have any other thoughts? You might have better thoughts about that.
Well, I do think about this a lot. You make a good point that when we have patients with advanced conditions, more advanced challenges in terms of their physical well-being, or they have more major depression, major anxiety, we need to be thinking about a number of interventions, and one of those interventions would be in the positive psychology sphere, along with, in some cases, we like to avoid medication, but we may need medication. We may need to think about referring to a psychiatry expert, mental health expert, etc. But I think that there is a place for this for everyone, even with those patients. It's just like you said, whether these kinds of approaches, positive psychology approaches, are the primary treatment or more of a supplement in addition to other treatments that are needed. So, yeah, I still think it can be for everyone. And you were mentioning how, well, you're busy. When you're busy, you might want to start small, and that's good advice for our listeners, and start with a subgroup of patients. We could also think about our other resources where we can refer out to the other healthcare team members and coaches, and possibly some other community resources and apps to help us out as well.
Yeah, that's a really good point. And I think if you have a bigger practice, maybe incorporating certain things into patient pathways, workflows is another way to do that, so that everyone knows, okay, if a patient comes with YZ condition, so they have a duty of care to make sure that they go through these procedures and get some knowledge and get some training into using certain techniques into their, or try and incorporate them into their daily routines. So yeah, absolutely right. Having the referrals, referral systems, and incorporating them into pathways, patient care pathways, might be a really good tool as well.
Yeah. And in the introduction, I should have also mentioned that you have been involved in some initiatives in Sri Lanka, initiatives in Singapore. Is there anything you can share for our global audience about what's happening in those places?
Where shall I start? Maybe I'll start with the story in Sri Lanka. So do you let me just start broadly about lifestyle medicine in general. So when we, I think, first started in 2019, there was a very small group of people, and struggling with a lot of things, with manpower, money, whatnot, like everything. So you don't have anything except your whatever the knowledge you have and the kind of determination you have, right? And some level of perseverance, I suppose. Over the course of last 2 to 3 years, I think, especially over the last 3 years, we had like a lot of snowball effect. Great people coming and contributing with ideas and knowledge, with their skills. So yeah, it has been a tremendous experience, and especially building organizations after all, when looking back, I think one of the best things we did, if we did it right, was investing on people and finding the right people for the right place and right time. Yeah, I think that was the first. That was the most important thing we did, because it was a very slow journey. We intentionally sometimes when we intentionally pick people, like give some time, let people to work with the core group of people and get to know them. And so it was a very interesting journey, a lot of very steep learning curve. Had to learn things through formal, informal, like reading books and trying to understand things, taking courses, and at the same time informally talking to a lot of people from around the world. There has been a lot of support, very generous support from people from the US and from Australia, particularly. Yeah.
Yes. The lifestyle
Yeah,
medicine community globally has really been igniting all around, and
that's
it
right.
is very supportive. We're all supporting each other
Yeah,
across
yeah,
many countries. But what you describe is that every place has a few of those early adopters or champions who can be opinion leaders and can influence others around them.
yeah.
And so that's how we've started lifestyle medicine here in the US. And it sounds like that's what you guys are doing in Sri Lanka.
Yeah, that's right. Oh, yeah, I should not forget the BSLM, the British counterparts, the UK. They also supported quite a lot, actually. And I think l looking back, or rather today, the responsibilities are enormous because we have brought it to a level that it has to sustain now, and at a level that it's a very inflated level right now. Uh, Not inflated for the wrong reasons, it's all for the right reasons, but just that keeping that enthusiasm, keeping that level of activity at the same level, and taking it forward from there is a massive challenge. Yeah, that's where we are right now. We are now doing a complete overhaul within the organization, and changing the structure, and changing everything, including basic things like how we are conducting board meetings, etc., to how we are reaching out to the communities. But it's again, once again, it's a little bit of a slow process. Yeah, it's been going on for like months now to date. Yeah. Well, and when it comes to positive psychology part, of course, we are still lagging behind. And thank you very much for being playing a huge role in igniting that in both in Sri Lanka, and we did some work in Singapore as well. Yeah,
Yes. Yes. Thank you.
yeah, and yeah, no, thank you for for doing it, but it's going to take a little bit more time to see the results. Yeah, it's going to take a little bit more time to see results in terms of actually things being applied in settings. So now we have a couple of more clinics coming up in Sri Lanka, dedicated lifestyle medicine clinics. Um, so with that, I think this is the time to see how these things are being played out, as well as to start obviously collecting data, and writing and talking about the experiences in more numerical way, the more statistical way, I think.
Yeah. Yeah. Well, we certainly
Yeah,
need both the data to move lifestyle medicine, positive psychology along, all the evidence base, but also the stories. And so that's also a
absolutely.
big part
Yeah.
of this podcast with our colleagues, is to share our stories and inspire each other. So yes.
Yeah. After completing the sentence, I was just thinking back of my mind, oh yeah, actually the stories is more and more I'm realizing the importance of stories. Yeah, it could be data-driven stories or just stories in general, because scientific storytelling is a kind of a thing now,
Yeah.
and this is a very different than time of the history. It's not what we used to see. It's not the way that we used to look at the world through the lens of science, and how we used to inform and empower people with the scientific knowledge. It's very different now. Yeah, so this is something actually I need to catch up myself with, about the storytelling abilities, and how to do it around specific points. Yeah, there are a lot of things to learn and do, I think. Yeah.
So speaking of a lot of things to learn and do, what are some of your favorite resources that you're using to learn more about lifestyle medicine, positive psychology, positive health, and how to incorporate it and with your personal life as well as your professional life in the future, and recommendations for our colleagues?
Oh, I think I will probably go back to the same place where I started. I think I told you at the beginning, the Prof. Martin Seligman's the TED Talk. It was not even a TED Talk. I think if you Google, if you go onto YouTube and look for this TED Talk, it's about, I think, 20, 25 minutes long, but not the typical like glamorous background and a very glorified typical kind of TED Talk, but one of the very early ones from almost about 20 years ago. So I think I would go back to his first one of his books, the Positive Psychotherapy. Yeah, that's a useful tool. Other than that, I don't have many books in my in my book rack for dedicated for positive psychology, to be honest, except for the for this and the board review course, which is quite helpful in giving understanding a summary and going through the references and learning more about the areas that you're interested in social connectedness and positive psychology.
Yes, we really expanded those sections in the lifestyle medicine examination, certification examination, as well as now also in the curriculum, because that speaks to how powerful and important these are and how connected they are to healthy lifestyles and successful lifestyle medicine practice. So, yeah.
Yeah, and then I think the other two things, for online sources, I would suggest obviously the GPHI website. At the same time, the UPenn sources from University of Pennsylvania, they have enormous amount of resources as well. So GPHI website, the UPenn, and the two books. Those are the things I am using. And other than that, what else? I'm sorry, I'm yet to read your book, and that's the next thing I think I should be reading.
Thank you. Well, thank you for bringing that up. Yes, so through for the listeners, we through the work of the American College of Lifestyle Medicine and myself, we have the Roots of Positive Change, which is more of a clinical book that we're actually updating. And then there was my books, Strengths in the Mirror. And we're also coming out with a new one, Lifestyle Medicine from the Inside Out, that really looks at lifestyle medicine and positive psychology. So those are a little plug for the near future additional new resources. So yes.
Yeah, I'm really, really glad to see the level of energy and the enthusiasm you have to keep going one after the other. That's really great.
Thank you.
Yeah.
Oh, well, wonderful. Well, as we wrap up, do you have any single take-home message you would like to share with our listeners?
Single take-home message. Shall I say rather something to think and work on, maybe? So especially around the idea of well-being, which is historically argued and a fairly controversial topic when it comes to definition of well-being, and especially for researchers, it's a hard topic to grasp, and especially unless you are a qualitative researcher. If you are more of a person who's trying to put everything into numbers, then that's not your best friend, right? So I think working on that and continuing to working on that rather, because the ideas around it keeps expanding, and people keep adding more and more variables and defining it. It's getting better, and more we have better insights into neuroscience and what goes into the biomedical paradigm of that picture behind the scene, then we are more capable of explaining what's happening in the clinical settings, how we see change, and we have more better explanations now with science. So I think those are the things I would say I would add, so that at least whoever who is interested in research might be interested in now maybe going back and thinking about research question around that. And if it's one message, I would say start from somewhere. Just start with yourself or in your clinic. Ideally, of course, it has to be yourself in a If we just keep preaching but not practicing, that's not a really good thing, and we just become hypocrites. So yeah, start with yourself. And more importantly, like for the practice sake, I think just start from somewhere very specific and very small with a defined group of people, so that you can work your way through everyone in your practice eventually.
Small steps,
So
small steps,
yeah,
start small and
small
build.
steps. Yeah, yeah.
Is
Small is
very good
beautiful.
advice.
Small is
Absolutely.
beautiful. Someone said long time ago. Yeah.
Well, wonderful. Well, thank you so much for joining us for this podcast, Samandika. And thank you to our listeners to this GPHI podcast. We hope you'll join us on another one of these podcasts in our series. Please subscribe to our channel, and we'll see you again soon. Be safe, be happy and healthy. Take care, everyone.